A WakeMed nurse is accused of stealing 2,500 milliliters of fentanyl from an IV bag. The court paperwork doesn't really show what the suspect was intending to do with that drug, but we know that anywhere from 5 to 10 milliliters of fentanyl in its liquid form can be lethal. WRL's Destiny Patterson talked with a researcher about this emerging threat of liquid fentanyl.
Colleagues and patients praise Kellianne McGuire for her hard work as a nurse here at WakeMed. Despite the accolades, she now faces felony charges for stealing drugs from her job. Court documents say McGuire knowingly took 2,500 milliliters of fentanyl from an IV bag.
Let's put this into perspective. Liquid fentanyl is typically used in the hospital setting. A typical dose is less than a milliliter, and that can be used for pain management. 10 milliliters can be deadly. This is what 2,500 milliliters looks like. Researchers say they're starting to see a rise in injectable liquid fentanyl.
More things that looked like they had been diverted from a hospital supply somewhere.
Chief Scientist Barry Logan's U.S.-based lab issued an international public health alert. He says the point was to warn public health officials about fentanyl thefts, which he says aren't as potent as you think.
There certainly are ways that you could, empty all these vials out, treat them in a way to make them more concentrated. But you would still need a large volume of them in order to get a recreational dose.
I went to McGuire's listed address with the hopes of asking why she stole the drugs. No one answered. A WakeMed spokesperson told me McGuire is no longer employed with the health system. I asked when she started working for WakeMed. The hospital system did not respond to that question or a request for an interview.
McGuire is currently out on bond. Her next court date is scheduled for November 19th. Destiny Patterson, WRL News, Raleigh.